Hello and welcome to my YouTube channel. Today I'll be speaking to you about a condition that we most likely have experienced in times past or presently experiencing, but something that we are quite familiar with, and that's headache. Yes, headache. Headache simply means pain or discomfort in the head or face area. And it's something that we've experienced at some point in time and can be sometimes just mild and at other times quite troubling. There are different types of headache, ranging from migraine, cluster headache, and tension headache. And so many conditions can cause headache, from high blood pressure, malaria, typhoid, stroke, space occupying lesions such as brain tumors. Could also occur from conditions such as giant cell arthritis, which is a form of vasculitis. I've done a video on that, and I encourage you to make some time to watch that. Yes, hunger can also cause headache due to hypoglycemia, and then eye disorders such as glaucoma and sometimes sinusitis. But today I'll be focusing on just two aspects. Number one, tension headache, and then number two, analgesic or medication overuse headache. Yes, analgesic headache. You heard me correctly. Now, in tension headache, patient tends to have pain, the sides of the head, and then it feels as if there's a tight band around your head. What are the causes of tension headache? Number one, stress. If you've been stressed, really quite stressed, you could have tension headache. It could also be from poor sleep or insomnia, and then sometimes excessive ingestion of caffeinated drinks. What you may not realize is that when you take a lot of caffeinated drinks, you tend to go to the bathroom to pass urine, and that could make you dehydrated and in turn trigger headaches. So if you're drinking a lot of caffeinated drinks, you could actually be triggering headaches that you're experiencing. It's also important to mention that although we say that high blood pressure or hypertension can be a silent killer, if you look at that word, hypertension, tension, one of the things that could happen when patients have raised blood pressure is that they could have headaches. And so it's important that if you haven't checked your blood pressure for a long time, please make it a habit. Check your blood pressure from time to time. It's one very preventable cause of, high blood pressure that results in complications. It's a very, very important avoidable cause of death. And so, what do you do if you've got tension headache? There are a few things that you can do. Number one, the headache could simply resolve spontaneously. In other words, you didn't need to do anything, the headache gets better. Number two, you could sleep better. If you sleep better, the headache could resolve. Number three, you could reduce the amount of caffeinated drinks you're taking. Number four, you could use simple analgesics such as paracetamol. Now, it's important to mention that we said stress can be a cause of headache. Sometimes it's important to identify that the stress is coming from a person and not necessarily a circumstance. I explained that. So if you have somebody that's always putting you under pressure, under tension, so that person appears to be a stressor. In other words, in quotes, that person appears to be the cause of the headache or your headache, if you get what I mean. So it's important that you find ways to resolve the issues that you're having with the person that is presenting as a stressor so that you can address the headache. We've mentioned the use of simple analgesics, and that leads me to the other condition called medication-overuse headache, also called analgesic headache or rebound headache. For patients that use analgesics such as paracetamol or non-steroidal anti-inflammatory drugs quite regularly, say about 15 times in a month, they may not realize that although they're taking these medications to try and address the headache, they're actually the reason why the headache is occurring, because they are using or actually overusing painkillers too frequently. Medication overuse or analgesic headache or rebound headache. And so for such people, what do they need to do? Basically, it's to stop the medication. Now, for some people, they could stop abruptly. For others, it may be necessary to taper or gradually reduce and then discontinue the use of the medication. And so in this video, we've talked about headache, different types of headache, but focused on tension headache and medication overuse headache. In another video, I'll tell you when to visit a doctor on account of headache. Thank you. And if you haven't subscribed, make our time. Take just a few seconds to do that. Thank you. Bye.